Welcome back to N-Powerment Nursing. I am Ashley, and this is our weekly test question where we apply our Facebook Live on prioritization. If you didn't catch our Facebook Live, you can catch the replay on our Facebook page. So I'm going to read our question here. You are ambulating a cardiac patient who is being monitored with telemetry when the charge nurse reports that the patient has developed supraventricular tachycardia at a heart rate of 158 beats per minute. In which order will you take the following actions? So we know this is a prioritization question because it's asking us which order we're going to prioritize our actions in, okay? So this is a high level question because it requires an amount of critical thinking beyond just content knowledge. So here's our options. 1, check the patient's blood pressure. 2, give oxygen by nasal cannula, PRN. 3, call the physician. And 4, have the patient sit down in the nearest chair. So I'm going to give you the correct answer right off the hop, and then I'm going to explain why. So the correct order of intervention would be 4, 2, 1, 3. Okay? So the very first thing we're going to do is number 4. We're going to have the patient sit down in the nearest chair. There's 2 reasons why this is the best answer, the very first thing we're going to do. 1, when you know the content around heart failure in a cardiac event, we need to decrease the workload on that heart immediately. Also, right, patient safety, Maslow's hierarchy of needs that we talk about in our prioritization Facebook Live, is physiological needs and safety, right? So 4 is the very first thing. The next one, give oxygen by nasal cannula, PRN. So the next thing we're going to do is apply oxygen to our patient. When we know our content, we know the heart is struggling, there's going to be a decreased cardiac output, therefore decreased oxygenization, therefore decreased tissue perfusion. So we need to get oxygen to maximize the oxygen carrying capacity of the body immediately. That is Maslow's lowest level, also abiding by the ABCs. So that's our next option, number 2. Number 1, check the patient's blood pressure. Why would we do this before phoning the physician? Well, that's because the nursing process, ADPI or assessment, we need to assess that patient before we phone the doctor. Why? Because the doctor's first question might be, well, what's the patient's blood pressure? And you're going to waste time if you have to then get off the phone with the physician, go back to the patient, take the patient's blood pressure, and then phone the doctor back. The only time when you would phone the physician immediately or do an intervention prior to assessing would be if there's an extremely life-threatening situation right now where you need to do something before you even assess. And this situation does not qualify for that. And lastly, the very last thing we would do is phone the physician, right? Number 3. And it's worth mentioning that often when phoning the physician is an option, students writing exam questions tend to gravitate towards phoning the physician because this sounds very scary, right? In terms of how the question is worded. Not correct. There's very few situations in which you're going to just call the doctor. Usually there's an intervention or an assessment that needs to come prior to phoning the physician. There are a few exceptions to this rule, which you can check out for the answer to that question and more in our complete study package. We do have an entire section in this study package on prioritization that will tell you when do you phone the doctor prior to doing something? When do you sit up the patient prior to putting on oxygen? And so on and so forth. So thanks so much for joining me, and we'll see you next time. Bye for now.